Hi, I'm Nanette Nessel, physician and CEO of the coaching company Beat Down Burnout, and I'd like to discuss the 5 ways I think we can improve and reform healthcare. The first is open, honest communication. Now, I know everybody says, oh, we need to improve communication, and I can improve communication, and this is how to improve communication, but let me explain something. Everyone talks about digital transformation and the great digital transformation, but do you know how many physicians absolutely hate their electronic health record or why they hate their electronic health record? It's because they feel like they can't develop a relationship with their patients while they're on their EHR, and that their EHR is a huge time sink. They haven't figured out how to use it effectively. The answer to these two problems involves communicating with the IT experts in their own organization and helping those experts to pass the problems on to the experts at the EHR corporation to find a solution. So the answer to that is open, honest communication. The problem is that the physicians speak from their core values and the IT experts speak from their core values. And it's like they're speaking two totally different languages. And any IT consultant who's gone into a healthcare organization will confirm this for you. They're speaking completely different languages. And the only way to correct this is for them to know one another's values, which is the second factor. Know each other's values. So the first is open, honest communication. The second is known values. So if you have open, honest communication based upon knowing the values of the speaker, we can move mountains. Knowing the values of the speaker is huge. You begin to not only value that speaker more as a person, but value the problems that are their problems. And it really opens up all kinds of barriers that were getting in the way of problem solving. And once you start communicating this way, you can then tackle things like setting boundaries, which is the third factor. You can set boundaries around workloads. You can set boundaries to protect your time off. And if you have entire teams doing this or entire organizations doing this, then you can set boundaries that protect against moral injury. You can set boundaries that create safe workspaces and prevent or even create workspaces that help you recover from burnout. So you can prevent and recover from burnout. And this is huge in healthcare right now. The fourth factor I would do is to help people get recognized for their expertise. How many times have I heard stories from staff members in organizations, whether it's a large clinic or an entire hospital? I've heard story after story where the only recognition they got was pizza. And it was brought in on day shift. And by the time the night shift got there were two pieces left that were all curled up and the consistency of cardboard. So night shift didn't know whether to feel recognized or insulted. Pizza is no longer a motivator. Food in general is no longer a motivator. We need to be doing things that really speak to our staff's hearts and to know that you have to go back to factor number 2 of knowing their values. You can recognize people without spending a lot of money. It can be done just in words, or it can be detailing a car. It can be providing childcare so that they can have an evening out. It can be helping them by providing a tutor for a child who's having difficulty in school, or providing a tutor for whatever ongoing education they're doing. There are so many ways. It can be saying you did a good job. The words can be enough. But often we see them saying you did a good job only to one class of employees, not to the organization as a whole, which then causes infighting. Surprise, surprise. But if you get this right and you do it organization wide, you then start rebuilding trust. And building trust is factor number 5. This is what makes you become an organization that is a magnet for talent. When you're recognizing your staff the way they want to be recognized and you're rebuilding trust, you become the place where everyone wants to work. You no longer have problems with staff retention. You no longer have problems with staff satisfaction. Think about that and what that's going to do for your bottom line. I'm Dr. Nan Nessel of Beat Down Burnout. Let me know how I can help you.